And so if someone's picking a clinic, in your opinion, should they be picking the clinic based on their lab? And if so, how do we even do that? Like, what types of things are we looking for if we want more information on the lab side of things before we're stepping through those doors?
Well, I mean, one of the things that they want to trust their doctor. You mentioned that in the beginning,
Mm-hmm.
you want trust, and without trust, you don't have anything. And so you have to trust your doctor. I would encourage people to ask to meet someone from the lab. It shouldn't have to just be me. It could be my lab supervisor. It could be any one of my team members. If they're not comfortable with any one person that would come out and talk to them, then they should ask these questions about that. Like, what are your pregnancy rates? In the U.S., we actually have SART.org. You
Right.
can actually look up clinics on the SART website and see what their pregnancy rates are,
Mm-hmm.
what their volume is. There's some places that, like historically, some lab directors always run good laboratories. Like I've always ran some of the top laboratories in the networks I've worked within. When I was at Aspire Inception, I had the number one, number two lab, the labs I directed. At IntegraMed, I was the number one lab in the IntegraMed system. So those are some things that I'm very proud of myself as a lab director. And so for me, mediocrity is not in my vocabulary. And so are you getting that feeling from their team members? Do you trust them at that level?
Yeah. And they feel we can confidently say when we're getting someone's success rates and pregnancy rates and the volume of which they're working, that's a way for us to say, okay, this is a good lab without really needing all the like nitty gritty info of what they're doing behind the scenes.
Yeah. There's one of the reasons why I developed the academy was, when I was working on my doctorate degree. I'm a late bloomer. I got my doctorate degree when I was about 45, 44. And we started looking at generations, and the Gen Z and Gen Y and Gen Z are the largest generations of like the 20th and 21st century. That even both of those generations alone are bigger than the baby boomers. And I think that's why it's not so much that there is more demand, just because there's just more of these young people. They're starting to get the fertility years. They're starting to preserve fertility. They might want to, can you do genetic testing for celiac disease or PG, or cystic fibrosis or Huntington's disease? Like, so we're not doing embryo IVF just for tubal factor and male factor anymore.
Yeah.
So there's more and more demand for that. And that's where I started hiring, teaching in the academy, and so because of this more and more demand, we're getting, our labs might be actually understaffed. And so are they staffed at a level that they can handle the volume?
Right.
And I know in some states, and even like in Canada, I do know that there's been some mandated coverage from insurance companies or the states now to mandate actual IVF coverage. So what that does, that increases demand even more.
Right.
And there's not enough doctors, there's not enough nurses, there's not enough embryologists, not just about the lab, and that's what we're trying to do at the academy, is we're doing the whole practice: doctors, nurses, medical assistants, even the billing people, like, understanding how to bill for the IVF. And so we're actually teaching OBGYNs, and maybe at some point that maybe the OBGYNs are in some of these other areas in the country that don't have access to fertility labs, right? Like San Angelo or Corpus Christi, there's no IVF, but there's, a million people there.
Right.
Clearly there's probably around, 70,000 people that need treatment. But, if we get an OBGYN that can understand how to do the fertility workup, they can send them to San Antonio to have their retrievals done, or Houston. And so we're teaching these doctors how to do more within their practice.
Yeah.
And nurses too.
Yeah.